friends, my name is Mukesh Kumar. Once again, I welcome you all in my YouTube channel. This video is going to elaborate all the things regarding the multiple sclerosis disease, which is a kind of disease of brain, spinal cord and optic nerve as well. So friends, first of all, we will have to understand what is the neuron cell and what are the parts of the neuron cell, what are their responsibilities and role of the nerve cell. So first of all, just let's start about the neuron cell and its structure, because friends, whatever I am going to tell you based on the multiple sclerosis disease, that is fully dependent on the myelin sheath damage, which is a part of neuron cell. Friends, neuron cell consists of many things, many different part of its are there, like the myelin sheath, axon terminals, cyton, axons, dendrites, cell body, etc. But in this video, we will understand what is the multiple sclerosis, which is caused by the myelin sheath damage. So, myelin sheath is responsible and proteinous in nature, which is a outer layer of a neuron cell. Like suppose if you are taking a wire of the electric, so electrical wire is insulated by the plastic material. So, suppose the plastic material is a myelin sheath in your nerve cell, which is responsible for inhibiting the leakage of the electrical currents. So, here in the same way, in the neuron cell, the myelin sheath is responsible to prohibit or to inhibit the electrical impulses from the neuron cell. Once the damage in the myelin sheath leads to the multiple sclerosis disease. Friends, you will feel amazing. Why? Because the myelin sheath, once it leaks the currents, sometimes patients may feel the multiple sclerosis disease or seizures, but whenever it is in a good manner on the insulating thing, like the nerve cell is in a proper manner, there is no damage in the myelin sheath, means the current flows in the nerve cell, mean to say 120 kilometers per second. Friends, why myelin sheath damages? Because sometimes in the body there is a system that is called the immune system. So sometimes mistakenly body and immune system understands itself like the enemy and attacks on its own body, on its own immune system. So that's why it leads the myelin sheath damage, and multiple sclerosis disease occurs in the brain, which affect the optical nerves and sometimes spinal cords also. Multiple sclerosis disease is a autoimmune disorder in which the body attacks in itself and immune system understands that body is the enemy and it's begins to attack in itself. Friends, you must be aware of the communication between the two neuron cells through the dendrites and axon terminal takes place due to the miscommunication, due to the nerve damage, mean to say myelin sheath damage. There is a miscommunication happens between the two neuron cells and leads the multiple sclerosis disease. Suppose if you are going to raise your hand, but due to the miscommunication between cell, you can't raise your hand and sometimes you mistakenly do another things whatever you want. So friends, if I talk about the types of the multiple sclerosis disease, so first is the relapsing and remission, mean to say remission of and relapses of the multiple sclerosis disease takes place in the initial phases, and that is the most common. But on the second number, that is the second type of the MS disease, that is progressive multiple disorder. Third one, that is a type of multiple sclerosis disease, that is a progressive and secondary multiple sclerosis, in which from the beginning it worsen the disease and the worsen the conditions of the patient, that is progressive multiple sclerosis disease. The fourth type of the MS disease is that is progressive relapsing, mean to say it gradually relapses the condition of the patient which is suffering with multiple sclerosis disease, and from the on site and up to the end, mean to say the progressive relapses are happening in the body of the patient. So it worsens the condition, that is the fourth condition of the MS disease, that is very dangerous in the nature. So friends, if I talk about the some symptoms of the MS disease, that is the vision problems. As I earlier said that it affects the optic nerves here. So vision problems will be there, and weaknesses, because the miscommunication between the two neuron cell happens. So weakness and muscle strength can be very much poor. So that's why sometimes patients may feel fatigue, and some other symptoms are also there of the MS disease. With these symptoms, some cognitive factors are there, cognitive dysfunctions are also there, like the poor concentration may also be there, and memory loss of the patients may also be there, and sometimes coordinations and balancing of the body will be affected completely due to the MS disease. Patients may feel also bladder and bowel problems, and sometimes patients may feel the emotional changes like the anxiety and depression may also be there due to the MS disease. So friends, if I talk about the diagnosis of the MS disease, so your doctor, your neurologist can diagnose the disease due to with the help of the some lab test, into the blood test and MRI scanning and physical examination. Your doctor can check your medical history and some other scannings like evoked, we can say, I am forgetting that particular thing. So many things are there by which this particular disease can be diagnosed. So just go towards your neurologist, and the doctor will consult you, and the doctor will tell you whether you are being diagnosed with the multiple sclerosis disease or anything else. As per my research, if I say friends about the treatments of this disease, so some disease modifying therapies treatments are given, like the teriflunomide, interferons, fingolimod and dimethyl fumarates are the medications of this particular disease. And on other hand, some symptomatic reliefs are given by giving and by prescribing some steroids and painkillers to the patients. So patients may feel very easy for some time, but I will be advising you just to consult with your neurologist, because it's a kind of disease of the nervous system only. So consult your neurologist as soon as possible whenever you feel such kind of symptoms in your body. Friends, if I say about the some other researches are going on this particular disease, like the immunomodulatory therapies and gene therapies, some researches are continue on this particular disease, and you will be very much wonder to know that almost 2 lakh people in India are affected with the disease, and most preferably we can say the targeted patients are much towards this disease are women only, and in some cases the women who are in white in color, I mean to say in fair in color, so it's a disease belongs to them only, because some theories supports, some research article supports it's a disease of the people who are living in cold areas. So it's a disease of, we can say, western countries, but it's affecting in the India also as of now, research as says. So just go to your neurologist if you are suffering with this kind of disease and symptoms as well. Friends, if I say the Multiple Sclerosis Society of India says like almost 2 lakh people are affected as per the registration of the patients are affected with this very critical and very rare disease which is near to death. So be aware about this particular disease and go towards your neurologist as well. So friends, for this video just I would like to take a full stop as of now. So meet you in the next video, and I hope you will be getting such videos and such content regarding your pharmacology and regarding your some medical expectations which will be meeting to you. So meet you in the next videos with such amazing facts and some such a critical disease with you in the further. Bye for now, have a good day.